was a rocky road.
Food would get stuck in my throat, and I thought that was just like something that was normal, but it wasn't.
Her EOE, the eosinophilic esophagitis, it was so severe that she actually had scar tissue.
Grace Pauley was diagnosed with eosinophilic esophagitis at age 11.
Eosinophilic esophagitis is an allergic disorder, and it affects the food pipe, which is the esophagus.
Dr. Sophia Patel is a pediatric gastroenterologist at Cleveland Clinic Children's.
What happens is a lot of times patients will have an exposure to certain foods, which we all eat, including milk, wheat, and eggs. And what that does is it causes an allergic process to form in the esophagus.
Because it's not detectable with traditional allergy scratch testing or blood work, patients with EOE have routine endoscopies to see if treatments are working. Between missed school time and having anesthesia, it's not easy.
Having to get there so early and all the tests, the pre-test, and like putting the IV in, and then like have to be there like 3 hours before the actual scope or something, and then I have to stay 2 hours afterwards so they could observe me, and then I'd be so tired for the rest of the day.
Grace's team at Cleveland Clinic has found a way to make this easier using virtual reality goggles and a procedure called transnasal endoscopy.
So the patients have their nose and their throat numbed, and then what we do is we take a very small scope, which is kind of this big, very small, you have to imagine. It doesn't, there's not a lot of room in there. So, and then after the patient's nose and throat are numb, they're awake, and we go in with the scope, and because it has a camera again on the end, we go in back through their nasal passages and then through their throat into their food pipe. So not into their lungs, so they're able to breathe, they're awake during the procedure. And we usually give them a couple sips of water to kind of help the scope go down. And then while they're doing that, we are able to also get those sample tissue biopsies as well. And the whole procedure takes about 5 to 8 minutes for the most part.
I've had it 3 times, and I used the VR the first 2 times. And I like that because I couldn't see what they were doing, and that's what I was hoping, because I was scared at first. But yeah, they had this really calming like meditation thing to watch, and just soft music playing, and it was really helpful.
Patients can be in and out of appointments in less than an hour and can return to normal activities immediately. Grace is now 18, adding foods back into her diet when the scope shows it's okay, and looking forward to her future.
I went to go to college and double major in music and psychology, and maybe eventually be a music therapist, because they were always really helpful to me back when I would have my first scopes when I was 11.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.